Hi, my name is Dr. Keasha Russell, and I will be the one being interviewed today. So, first interview question: what do you find most enjoyable about your job? What I find most enjoyable about my job is one, that I get to be involved in healthcare. I get to help individuals reach a level of fitness that they never thought they could, reach a level of health that they never thought they could. And I like athletic training because it dives into the different avenues of health. And so you not only learn how to prevent injuries, but you learn how to evaluate them, how to treat them, how to rehabilitate them. You learn how to provide nutrition to individuals. You learn about psychological health. You learn about different types of conditions and illnesses, general medicine that an individual could be involved in. So I like the aspect of diving into multiple areas of healthcare with athletic training. All right, second question. What is the most challenging part of the job? The most challenging part, I would say, especially for the secondary school setting, is the fact that you're generally by yourself with hundreds of athletes, and it's really hard to carry a patient caseload like that. So, out of all of it, I would say that's the most challenging portion of it. All right, question three: how many hours do you work in a typical day? So when I was teaching and doing athletic training, I was working anywhere from 12 to 14 hours, 15 hours on some occasions. Football nights would be up to 16 hours. Now that I'm just teaching and not the head athletic trainer on campus, now my work days generally go from about 8 to 4 or 5 o'clock. So less hours. I still do help out on campus, but those are just volunteer hours, so I really don't count those. Next question, number four: what skills are required for your job on a day-to-day basis? So on a day-to-day basis, my main goal is education. And my job is to set up a didactic educational environment for students to learn sports medicine and to learn about athletic training. In the clinic, the main goal for me now is to help support the other athletic trainer on campus in terms of evaluation and running the clinic, rehabilitation, providing emergency response to the sports, and providing nutrition and psychological interventions and services for some of the student athletes that need it on campus. Number five: what training or degree is required for your position? So for my position specifically, for teaching, you need to have a bachelor's in either BA or BS in sports medicine or kinesiology, and you have to have at least 3 years worth of experience in athletic training or sports medicine or in the medical field in general. When it comes to athletic training, educational requirements that I needed to go through back in the day, this was back in 2010, you had to get a bachelor's, you had to go through a CATIE accredited program, and you had to complete that program as well as pass a national exam. Now, you need to not only have a bachelor's and go through a CATIE accredited program, but you also need to have a master's as well as pass the national exam. So the requirement has increased, which I'm happy with because it shows a little more rigor to our profession, and it shows that we are professionals and we're not just kids freshly graduating from undergrad and going into the medical field. Number six: what changes do you think will happen in this field within the next 5 years? I think in the next 5 years, we're going to see an increase in respect when it comes to athletic trainers and sports medicine. We're going to see a lot more maturity, and we're going to see an increase in ability to really track the types of services and the treatments that we're providing. I know with injury recording in the past for athletic trainers, it's been difficult, and my experience is a lot of that is because of the patient caseload that we have and the responsibilities that us as one person needs to take. But as we're seeing multiple athletic trainers being able to work at the same venue, especially at the secondary school setting, I think that record keeping is going to be a lot more accurate, and it's going to help us push the profession along even more so. Seven: what opportunities are available in this field, advanced trainings or specialties? When it comes to athletic training, generally athletic training is a healthcare field in itself. It's a very fun healthcare field in itself, but I do have friends personally who have gone on to be PAs or physician assistants. I have friends that have gone on to be physical therapists. I've had friends that started as physical therapists, but then also got their credential and certification as an athletic trainer. So there's different specialties and areas you can go into, especially because athletic training encompasses so many different areas of medicine that there are individuals that become orthopedic surgeons. There's individuals that take that education and become nurses. There's individuals that take that education and they go into the pharmaceutical business, or they become nutritionists or strength and conditioning coaches. So it's really applicable to all different aspects of healthcare and fitness and performance. It just depends on what your personal want and desire and interest is in terms of those fields. Number 8, what would be a reasonable salary range to expect if I entered the field? What is the long-term potential for salary? So when I started, we started at about $15 an hour. Actually, some were $8 an hour. Now it ranges anywhere between $25 to $35 an hour. Some are getting up to $50 an hour. Me personally, because now I have a doctorate in athletic training and I do have experience, I generally charge at least $40 an hour for my services. But it really depends on you. It depends on what you want to accept. But for the profession itself, it's really recommended and suggested that you don't take anything below $25 an hour, even if you're brand new certified, because we do a lot. And there's a lot that we contribute, and there's a lot of liability that we take on as athletic trainers. And it's the medical field. You'll never ask a physical therapist or a physician to work for $15 an hour. So athletic trainers, because of our specialty, because of what we can provide to the teams, and because of what we can provide to the venue, we really want to understand our worth and we really want to express that. Long-term potential depends on the venue you go in. So secondary school settings, the salary is coming up to a point that makes living comfortable. If you want to go into the collegiate setting, obviously athletic trainers have been a little more established in that realm for a longer period of time. So you will be able to see a higher salary wage from that. If you go into the professional realm, you'll see a higher salary range from that. But what I tell a lot of students is you really want to pay attention to the amount of hours that are being asked of you. And if you're the type where you like to know that you have a job for the next year and you don't want to work 80 hours a week, then I don't suggest following the glory of the title of working with professional teams or even collegiate teams, because you're going to spend a lot of hours doing that. If you're the type where you don't care about hours, you'll work 100 hours a week and that's fine with you, then go ahead and go for those levels. But for me personally, because of my future goals that I have, I don't want to be stuck working 80 to 100 hours a week. I really want to have a flexible schedule so I can not only have my career, but I can also have that separate time for family and friends and going on vacations if I want to. All right. Number 9, what qualifications does someone look for when hiring new people in the field? Do you have any recommendations for me to build these skills now? Biggest thing I can say is critical thinking is huge. You have individuals that are extremely book smart. They've gone through programs and they've aced those programs. They've gone through beautifully. But when it comes to the field, everything's so quick that you really need to have those critical thinking skills to be able to handle the different situations that you'll come across. And a lot of it is time management, especially if you're working solo with a team or you're working solo with a school. You're going to need to learn how to prioritize what is important now and what can be saved for later. So I would say critical thinking skills is big. Learn how to think on your toes and learn how to think efficiently on your toes, which is what critical thinking is. And also time management. So if you can start to manage the responsibilities that you have now, either via a calendar, you can utilize your phone for that. Just learn and develop that skill of managing all the priorities that you have efficiently, because that's really going to translate into the athletic training or sports medicine field. Third one I would give you is communication. Communication is going to be extremely beneficial in terms of how you talk to individuals and who you're going to have to talk to. In my personal situation, there are times where I talk to athletes, I have to talk to parents, I have to talk to staff members, I have to talk to coaches or referees, or I have to talk to board members. There's individuals in charge of salary, like the principal, assistant principals, admin staff. So you really want to develop your communication skills to be clear and concise, and to be able to communicate your message effectively. All right, number 10. I Actually, so building the skills now, I hope I covered that pretty well. Really just start working on your critical thinking skills, thinking on your toes, thinking for yourself, not allowing other individuals to put their personal input or their personal feelings into it. If you know that the decision you need to make is right, then make that right decision, regardless of if anyone else is begging you to make a different decision. For example, if you have a individual, let's say a quarterback, it's a championship game, you know he has a head injury, he may not be showing severe signs, but you know it's unsafe for him to be out there. It doesn't matter if the coaches are yapping in your ear. You know what is the right decision to make. You need to make that. Time management, again, get a calendar, learn how to manage your priorities. And communication, talk to people, network, get to know people. The more you practice these, the easier it's going to come. Number 10, what other fields should I explore that are related to this field? So like I mentioned earlier, there's physical therapy. You can be a physical therapy assistant. I've had students that have gone on into physical therapy clinics to work as assistants. You can become an orthopedic. You can become a physician, a natural healthcare practitioner. You can become a physician's assistant. You can become a, like I said, pharmacist, strength and conditioning coach. So you really want to go to these different areas and see if you can shadow people, see if you can intern for free, see if you can just help out, because you never really know if you're going to like it until you actually get into that situation, you get into that venue. Once you get into that situation, you spend some time there, then you'll see if it's a good fit for you or not. All right, number 11, if you could start all over again, would you change your career path? If yes, why? I personally wouldn't change my career path. I think that I've been put on this path for a reason, and there are other things that had to be eliminated from my life to get me on this path. And I've really enjoyed everyone I've come in contact with. I've enjoyed all of my triumphs as well as all of my trials and challenges. And not a lot of people can say they've enjoyed those challenges, but truly in athletic training and sports medicine, it has given me unique challenges to develop me more as a professional and more as a healthcare provider, to where I'm extremely confident in myself and my skill and my knowledge. And I wouldn't have gotten there if it wasn't for those challenges. So in terms of changing my career field, I wouldn't. One thing I recommend to students is don't think of a career as a one option deal. Think of a career as you have your first career, then you can have a second or even a third career. So my first career was athletic training, but that's guided me into what I'm seeing as my second career, which is full education at the collegiate level. And who knows, maybe I'll have a third career option at some point. But never think of it as you have one career and you have to stick with it. Just think of it, this is your first career and it could change into something different later. All right, and then last question, do you have any other advice for me? My advice would be to write down 3 to 5 areas of a career that you're interested in, and go ahead and spend a week, 2 weeks, maybe even a month if you have the time in those areas. So if you want to be a strength and conditioning coach, find a local gym that has a strength and conditioning coach and just shadow someone for a week or so. See if it's something that you would like and ask them questions, pick their brains. Individuals in healthcare love when, especially young individuals, young adults come to us and they want to know information. They want to see what our life path was and how that was. If you want to be a athletic trainer, find an athletic trainer and go shadow them. Watch videos. If you want to be a physician, call a hospital and see if there's a way that you can shadow one of the physicians. There's always going to be opportunities for individuals to share their passion and to share their careers. You just have to seek those out and find those. And last piece of advice, just do not give up. It doesn't matter who says what. It doesn't matter if people say that you're not smart enough, that you can't do this, that no one else in your family has done it. So what makes you think you're going to do it? If you want to do it, you will find a way. You won't find an excuse. All right. I hope that's good.